I'm a native Atlantan. I attended medical school in Augusta at the Medical College of Georgia, and then trained in Charlottesville, Virginia at the University of Virginia, and came back to Atlanta and was in private practice for a couple of years, and then went to work for Emory Clinic, the Emory University School of Medicine. I was a senior associate in the Department of Internal Medicine. But basically the traffic was terrible. I was in the car 3 hours a day, both my wife and I driving to Emory, and we just couldn't get home to see the kids, so we decided to move to a college town. And I actually happened to go here as an undergraduate, so I'm a big Georgia fan, so Athens was a nice fit for me. Before, I had been based in the hospital for a number of years, and I missed the relationships with the patients, getting to know them long term. When you're based in the hospital, you just see the patients and get to know the patients and families during that hospitalization, and a lot of times you never see them again. So I was in private practice in Atlanta, many years ago, and I thought I would get back so I can have the long-term patient-doctor relationship. We're actually going to practice as an old-fashioned general practice, or like a family practice, although I'm an internist. Now, an internist classically treats the most complicated adult patients, usually 16 and up, whereas a general practitioner will see sick people. Well, we're going to see sick people too, so we're not going to be booked like most internists for a month ahead, 2 or 3 months ahead. We're going to try to work people in the same day or see them the next morning if they're sick. So we're going to be a hybrid of the internal medicine model, which taking care of the most complicated patients and seeing you when you're sick too. I think, in other words, I consider myself an old-fashioned general practitioner. What we've embraced is the technology. In 2010, we have electronic medical records, and it's going to make me a better doctor and a much more efficient office. We don't have any paper charts, and if I ever need to get any information, it's just literally a second or two. I can pull up a name on the computer and have their entire medical record, labs, immunizations, procedures, x-rays within a matter of seconds. So I have good relationships, professionally and personal relationships. I consider a lot of them friends, and I feel like I can just, pull out my cell phone and call them on their cell phone if I need a heart doctor or a gastroenterologist. I can just pick up the phone and call them and get them in right away. So hopefully, we can get people seen a little quicker because of just relationships I've built over years. It's very easy for an individual to become a patient in this practice. First of all, we're a new practice, so we are accepting new patients. But the practice in Athens fill up quickly, and very few people are taking Medicare. We're taking Medicare now, and we are accepting new patients and filling up very quickly.